Today on Patients at Risk, a patient develops severe and permanent facial nerve damage following a filler injection administered by a registered nurse practicing without physician supervision. Even worse, the report to the Board of Nursing goes unanswered as the board declines to take action against the nurse, who is now practicing as a nurse practitioner.
My name is Francesca. I was living in Tennessee, and I received an advertisement for a local med spa, which I foolishly did not study or research beforehand, and it was just offering a sale on Botox. And so without giving it much thought, I went to the med spa and I met a nurse there. She was not a nurse practitioner, but a nurse. I didn't know much about her. I didn't know much about her qualifications, and I really should have asked because she was not qualified to really be doing anything of that nature. But unfortunately, what happened was she told me that there was also a sale on filler, and so we discussed getting lip filler. And I went ahead and moved forward with getting this lip filler done by her. Initially, nothing went wrong. The filler looked fine. It was when I came back for a follow-up appointment that she decided to place the remainder of the filler in my chin, insisting that it could go there, that this product could be used anywhere in my face. I didn't know any better, and so I said, okay. Within several weeks, I began experiencing a numbing or tingling sensation in my lower left lip. Initially, I thought I was getting a cold sore, so I didn't think much of it, but as the weeks and then months kind of persisted, I was like, something is wrong. I need to do something. So I kind of freaked out. I eventually reached out to a different nurse practitioner at another med spa who immediately knew what was wrong. She knew that the lip filler that was placed in my chin was never intended for that area, and she immediately removed it. That's when I felt this pain that kind of erupted in my chin and spread throughout the rest of my face. What I thought was just maybe a small reaction to that, maybe the filler dissolvent. Within the months as it progressed, it was clear that I was suffering from some sort of nerve damage. We were hoping that it wasn't permanent, but as time went on, and as I failed various diagnostic tests, which were nerve blocks, it became apparent that I suffered permanent mental nerve damage from that filler that was not intended for that area. And that also triggered trigeminal neuralgia within my face. Before I was harmed, I was working in population health management for a large health insurance company. And I was going to school part-time to study social work. Unfortunately, all of those things have had to stop since being harmed because of the debilitating pain that resulted from it.
What a nightmare. So you said the first nurse was actually not a nurse practitioner, she was a registered nurse?
She was a registered nurse in school to become a nurse practitioner, really at one of Tennessee's top-rated, renowned medical schools that offered an MP program. Of course, it was online, unbeknownst to me. And she actually just graduated with her degree, her doctorate degree, and she's going to be practicing now as a nurse practitioner.
So I'm guessing, I don't think in Tennessee nurses are allowed to administer those types of injections. Was she acting under someone's license, or are they allowed?
They are allowed to. In fact, Tennessee is very kind of loose in terms of their regulations. I found out after the fact. You don't even have to be a clinician to open one of these medical spas, which was
Yeah.
very much the case in my thing. Some business owner, some entrepreneur just decided to franchise this med spa called Relive Health, multiple throughout the central Tennessee area, with what I believe to be is a plan of, lowering costs, so hiring nurses as opposed to highly trained, maybe nurse practitioners and or physicians. There obviously wasn't a doctor on site. They loosely have some doctor that they're associated with within the state, but that's about it.
I'm just sitting here thinking about how awful this is. You're a patient, you don't know a lot about these things. You see an advertisement and you think, Well, surely they wouldn't be allowed to offer or do these things. It wouldn't be something that the state would license if this wasn't something that was safe and okay to do. I'm assuming
Yeah.
that's what you're thinking, right?
Exactly. And this specific med spa chain, it seems only to operate in these states with legislation that allows non-clinicians to operate these medical spas.
And then you just think, how would you as a patient really without
I
knowing too
know.
much?
Mhm.
Because what we often hear from legislators and other people is, well, it's let the buyer beware. But don't you think you
Mhm.
have to have a certain amount of understanding and knowledge about medicine to make that decision?
Yeah, buyer beware is very I think the problem was I had resided in Illinois previously, and I had gotten things like Botox done, but it was at a dermatologist. It was like a medical spa dermatologist office where there was a dermatologist on site. There was physician assistants who were administering this Botox, but it was all done very professionally, and they were all very trained, and I made the mistake of thinking they were all like this, which clearly they are not. And so this kind of buyer beware is really scary. It's scary that it's unregulated because you're just going to have more and more cases like mine where these nurses and or nurse practitioners don't know what they're doing, have never received any formal training under either plastic surgeon or a dermatologist, and are just going to harm patients.
Yeah, they just seem to be able to hang a shingle and nobody really seems to be checking whether they're doing things properly or safely. I'm a family doctor, so I would never dare personally
Mhm.
to inject people with cosmetic substances without that proper training and education. It's shocking to me that anybody would feel confident in doing this. Maybe they don't understand just how many things can go wrong. I think they're thinking, "Oh, it's simple. It's just, little injections." But as you've described in your case, there are nerves. This can affect your function. It can affect your sensation. It can cause pain. And now you're left with, it sounds like, continuing ongoing pain in your face.
It's a nightmare. Every day I just live with this horrific pain, which can be somewhat tempered by gabapentin, but not really, and there's no recourse. I reached out to the state of Tennessee, their nursing board, and they didn't care. They thought that it did not rise to the level of public discipline, even though they had my medical records, and I think it's pretty obvious that this caused permanent nerve damage and then trigeminal neuralgia. And so it's really kind of like the Wild Wild West. Nobody is regulating these nurses and soon to be now nurse practitioners. Nobody really cares if they harm patients. There's no repercussions for them when they harm patients. Um, and really, you have these med spas, especially these kind of chain med spas, that are really kind of slimy and sleazy and operating in states specifically where they know you don't have to be a clinician to own it. And there maybe aren't as many rules or laws protecting patients.
I hope that we'll be able to get this information to the right people in the state of Tennessee and other states. And hopefully, we'll get this to some legislators so that they can become aware that this is a serious problem. In the meantime, what message do you have for people like you, patients, someone that's thinking about maybe having a little bit of cosmetic treatment? What should they know?
I would simply not move forward with it at all, to be honest. Don't get it. It's just not worth it. A lot of times now, even plastic surgeons' offices, they're kind of delegated. These things are delegated to nurse practitioners and PAs, most of whom I would say are well trained. But you just don't know. Like in my case, I was just left to the hands. I trusted somebody who was uneducated, untrained, and quite arrogant with what they thought they could do, and they really could cause a lot of harm. So I just don't think it's worth it to do Botox or these injectables unless you can find an actual plastic surgeon or a dermatologist to do so.
They should really be well aware of the risks. It doesn't sound like to me that you were really informed of any potential risks.
I was not at all informed of any potential risk. And not only that, but this injector knowingly, or maybe unknowingly, chose to put a product in a place where it wasn't intended. So that's just a total lack of knowledge there, and really just lack of care. You have these injectors who are very arrogant and I would say focused on money, and they have a complete lack of education and really care for patient safety. They don't take a Hippocratic oath, and they don't necessarily care for patients in the same ways that physicians would. And again, this obviously does not apply to, I would say, all nurse practitioners or PAs, but I would say there is a growing concern of younger nurses who really want just to go into aesthetics. They care about money. They don't care to undergo any real training, and they are a threat, I would say, to society.
Are you
Yeah.
considering seeking any type of legal recourse, like liability?
I tried, and unfortunately I signed a waiver, and I guess in signing a waiver that says that I accepted what happened to me, even though I was falsely told that this filler could go anywhere in my face.
It's just so sad to hear that something like this has happened. And again, like you said, I really feel
Yeah.
it's an example of patients being taken advantage of. You and patients like you are the exact reason that we're speaking out. It's funny
Mhm.
because we get a lot of criticism saying, we're not team players, we're not being supportive of our colleagues in nursing. And I'm a family doctor, so I have no skin in the game as far as aesthetics.
Exactly.
It's about, I don't want this to happen to me, to you, to a family member. There's a reason that doctors, especially in those specialties, go to
Mm.
school for such a long time so that they do know what's safe to put and what's not safe to put and what the potential risks are and how to mitigate them and how to take care of problems. It's not just so
Mhm.
simple that you can do online or a weekend course. You really have to put the
Exactly.
effort into it because patients' lives are in your hands.
And it's just so concerning that we seem to have a newer, younger generation. And I don't want to label all like Gen Z as this, but the girl who harmed me was 4 years younger than me, who are after this lifestyle, becoming an aesthetic nurse, becoming a nurse practitioner with very little experience, even as a nurse. Going to these programs and going to these good programs and this is where it fools people like me. They go to these renowned programs that are supposed to be very good and very rigorous, and they graduate with these doctoral programs. And you would think surely, they wouldn't graduate these incompetent individuals who are willing to harm their patients. But that very much wasn't the case for me. But I do want to say that the nurse practitioner who removed the filler, she was very competent. She had been a nurse practitioner for over 10, 15 years. She had trained under a plastic surgeon, and she knew immediately what was wrong. And so for those who are not competent, the nurse who harmed me was grossly incompetent. The nurse who removed my filler was very much more competent. And that should be acknowledged as well.
Yeah. Thank you so much for sharing your story.
Well, I appreciate that. And thank you for allowing me to share my story, because I've been thinking about whether or not to share it. There are a lot of people that would just blame me.
That's
Um,
what's so unfair. That's why you want to get the word out to say, how was I supposed to know? And somebody's supposed to be protecting the public. So we need warning signs. We need more awareness. If you're going to let this be legal, then we need to be aware of the risks. Well, I really appreciate you speaking out. I'm wishing you the very best. And
Thank you for allowing me to speak about this. It's very important to me.
since I'm a family doctor and I don't know that much about facial filler injections, I decided to reach out to an expert on the topic.
I'm Carmen Cavalli. I'm a board-certified plastic surgeon in private practice in Atlanta, Georgia for the last 23 years.
You heard about the case. What were your thoughts?
Well, it's not an unusual story, sadly. There's been a complete boom in med spa establishments, and most of them are now not owned or run by physicians or even by nurse practitioners or PAs, but RNs, paramedics in some states. And the interesting thing is that there is no state that allows an RN to make a medical diagnosis and prescribe any treatment independently. An RN can only administer a prescription, treatment, or product after a patient has been individually evaluated by either a physician, a PA, or a nurse practitioner, and an individual prescription has been written in the case of injectables, for instance.
And yet that is happening. And in the case that we both heard about, the patient explained that the only person she interacted with was a registered nurse who happened to be in nurse practitioner school at the time.
That's not uncommon. And I believe she also noted that the owner of the med spa was a business person. It wasn't anyone involved in medicine at all other than to make a profit. And so, yes, they're using these RNs to do treatments for which they are not qualified to do without the involvement of a physician, a PA, or a nurse practitioner. Botox is a prescription drug. Of course, it's actually a biologic and is only available by prescription. So an RN can't use it without a prescription for that individual patient. Dermal fillers are actually medical devices, again, only available under a specific prescription. There's no setting in which an RN could legally provide these services, but it's being done all over the place because there's not enough enforcement.
So just hearing the scenario, of course, you don't know the full facts of the case, but with what you heard about the type of filler, the location of the injection, does it sound like it was done properly and according to standard procedure?
So nerve injury can happen with fillers. However, the problems here went beyond the damage that happened. They go all the way to the informed consent. There is no FDA-approved filler in the United States that can be used in both the lip and the chin. None. So Francesca described that she initially had her lips injected, and then she went back sometime later, within a few weeks, and the rest of the syringe was used on her chin. There is no FDA-approved filler that is approved for use in both of those areas. None. So she did not have informed consent. I often use products off-label. There's nothing wrong with that, but the patient has to understand that it's off-label. It hasn't been studied in that area. And here are the reasons I think it's okay to do it there. That nurse had no such discussion, according to Francesca. She wasn't aware that it wasn't FDA approved for that area. The chin is a higher risk area for injection. You need to be a more experienced injector to be able to get it right. And in this case, there were symptoms, it sounds like, of nerve injury pretty early on.
Why could you use one type of filler in a lip and not in a chin? What is the mechanism behind that?
It's usually related to the rheology properties of the filler and the FDA trials that were done for that filler. The only two approved in the chin in the U.S. from any company are Volux and Velour. They are both Juvederm products. They're both hyaluronic acid, but they're more highly cross-linked, and they have different sizes of HA in the body of the filler. So they're a stiffer filler than the one you would use in the lip, for instance.
I'm just trying to wrap my mind around, like, is it something that experienced plastic surgeons would do to use that type of lip filler in the chin, or is it something that you definitely would not do yourself?
I wouldn't do it because it wouldn't give the effect that I'm looking for in the chin, but I would have a conversation with the patient if I chose to use it in an off-label place. The patient's going to understand that it's off-label, hasn't been studied in that body area, but here's why I think it might make sense. In this case, no, I wouldn't use, I don't know what was used in her lip. I assume it might be Juvederm Ultra or Ultra Plus. Those aren't approved for the chin, so I wouldn't use them there. You're not going to have enough lifting capacity from those.
You know, I sit here and listen to this, and I think the average person just thinks of these injectables as being, pretty low risk. You see them on TikTok, you see them on all the social media. What's the big deal? And, as a doctor, even though I'm not a plastic surgeon, when I went through gross anatomy and learned about the nerves and the blood vessels and the glands and all the elements of the face and all these really critical structures that are really rather shallow in some cases, I would personally never let someone that didn't have that full experience and training as a physician, and even more so, I personally wouldn't go to a family doctor or pediatrician or a non-facial plastic surgeon to do this to me, just knowing all the structures in the face and the potential damages. But yet, I think the average person doesn't have that insight. And one of the things that is often said that I hear from legislators and others is let the buyer beware. But do you think it's reasonable for patients to have that knowledge and understanding of these risks?
Absolutely not. The whole industry in aesthetic injectables has been completely commoditized. People want to know, how much does Botox cost for a unit at a given place? And that's how they decide where to go without any recognition of the fact that it is a medical procedure. And thankfully, most bad things that happen with Botox do go away. But bad things that happen from filler don't necessarily go away. And in fact, that intimate knowledge of anatomy is critical because areas of the face that people think of as lower risk, like the nasolabial folds, that's actually a super high risk area to inject. You can get blindness from actually you can get blindness from injecting anywhere in the face. If you think about the connectivity of the vessels, you can have a stroke from having a dermal filler injected because there are connections between the external and internal carotid within the face. So you can have stroke, you can have blindness, and that's on top of the vascular occlusions, which happen more often, but thankfully are still fairly rare and are usually reversible. But you can have tissue loss and permanent damage. And poor Francesca, with her nerve injury that turned into trigeminal neuralgia, she's probably always going to live with some level of pain. And I do hope that she continues to pursue action. It sounded like she beat on a lot of doors to try to figure out how to correct the situation and was just told no at every turn. The Board of Nursing said nothing was done wrong by the RN, and an attorney told her she didn't have a case because she signed a waiver. There is no waiver that any patient can sign that absolves the treating practitioner of liability. None. When you sign a consent to have a medical treatment performed, you are acknowledging that you've been informed of the reasonable expectation of risks and benefits. And yes, they can include severe things like stroke and death and blindness, but those are the outliers. They're on the list because they have happened and you should be informed of that. But if they happen in the setting of negligence, that doesn't make the consent absolve you of that negligence. Yes, you told the patient those things can happen, but if you have, it only impacts you legally if you have correctly performed the procedure and the adverse event still happens. Okay, you've done your part. But if you have incorrectly performed the procedure and an adverse event happens, that could be considered negligence, and that harm to the patient is due to your negligence, and that's not covered by the informed consent. I think she's been given some bad advice from the Board of Nursing. I think she should report to the Board of Medicine. There's got to be a physician somewhere involved in this whole venture. And if there's not, that's reportable as well. I would go to the Attorney General's office and I would find another attorney who understands that signing a waiver does not constitute informed consent or consent to negligently perform a procedure and harm someone. I think she just needs to keep looking until she finds the right people to advocate for her properly.
That's really great advice. And in the meantime, what she wanted to do was just share with the public her experience and warn patients that if you're going to be having any type of procedure, or I would take it even further, any type of medical evaluation or treatment, that you really need to make sure that you're being treated by a physician and someone certainly in the area of medicine that you're being treated for.
We really have to get the patients involved. And we do have hundreds and hundreds of stories of patient harm that have been sent to us either by email or through online form where we allow patients to tell their stories to us. We have the stories. We just need people to talk about them more.
And that's actually how we found Francesca. She messaged us through our Physicians for Patient Protection website, Tell Your Story, and said she would be open to sharing her story publicly. And so I reached out to her, and then we had that interview. So if you have experienced any harm or you have concerns about your own experience, then please send us a message. You can be anonymous, but we would love for you to use your name and tell your story publicly to prevent other people from going through what you've experienced. What we hear a lot is, well, none of the states that have allowed unsupervised practice have ever turned back and, well, there is no harm coming from this. And I think the reason people are saying that is because nobody's asking, nobody's looking for harm. And that's what we're here to do, is to expose that so that we can protect patients. Thanks so much for listening. I hope you enjoyed this episode. If you'd like to learn more about this topic, please consider getting the books Patients at Risk and the follow-up book Imposter Doctors. If you're a physician and you'd like to learn more about getting involved in our mission, which is advocating for physician-led care for all patients and truth and transparency among healthcare practitioners, then please join our group. It's called Physicians for Patient Protection. Our website is physiciansforpatientprotection.org. If you're a patient and you'd like to report your story of harm, or if you'd like to appear on the podcast, please send us a message through our website, patientsatrisk.com, or you can go to physiciansforpatientprotection.org, report your story. Thanks so much, and we'll see you on the next podcast.